Head lice infestations are common in school children. They are not a sign of poor hygiene. Answers from AboutKidsHealth.ca at the Hospital for Sick Children. What are head lice? Lice are small, gray, flat, wingless insects that live on the surface of the scalp. An adult louse is 2 to 4 millimeters long. Lice survive by staying close to the scalp. Adult lice lay eggs or nits that stick to the hair shaft. Signs and symptoms of head lice. Common symptoms of head lice include itchiness, tiny red bumps on the scalp, light gray lice eggs or nits sticking to the hair shaft. Sometimes there are no symptoms at all, but lice and nits can be seen. Causes of head lice. Anyone can get lice by sharing hats, combs, headphones, towels, or bedding. Lice can also move from one head to another if two people literally put their heads together. How to check if your child has head lice. If you suspect your child has head lice, use the following steps to check their hair. Wet your child's hair. Comb it with a lice removal comb, a small fine-tooth comb that you can buy in your local pharmacy. Submerge the comb in water in a white bowl. Look for the adult or baby lice at the bottom of the bowl. You may see the nits floating in the water, but they may be so well stuck that you may also need to examine the hairs near your child's scalp. It is also possible to see small live lice in your child's hair. Check especially around their ears and neckline. How to treat head lice. Consult your child's healthcare provider or pharmacist before treatment if your child has allergies to select an appropriate lice treatment. Otherwise, you can proceed to treat your child at home. There are several treatment options. Most products are not 100% effective the first time you use them, and you will usually need to repeat the treatment about a week later. Ask your pharmacist for advice on the best option for your child. Some children experience an itchy scalp even after successful treatment, and others may experience a scalp rash after treatment. If rash or itching persist or bother your child, you can speak to your child's healthcare provider or pharmacist. Preventing the spread of head lice. Check all family members for head lice. Each person who has head lice needs to be treated. If head lice are found, wash all combs and brushes in boiling water for 10 minutes to kill any lice or eggs. Wash all bedding and towels in hot water and dry them in a tumble dryer on a high setting for 15 minutes. Put anything that cannot be washed in sealed, airtight bags for 10 to 14 days. Contact your child's school if your child has head lice so the school can inform other parents. Encourage your child not to share hats, combs, brushes, headphones, or bedding with other children at school or at home. For more information about lice and other health topics, visit AboutKidsHealth.ca.